I'm Matt Elliott. I'm an anesthesiologist in Anderson, South Carolina, and I'm going to be interviewed by Haley Harris.
Okay, first question. As a doctor, how do nurses interact with you on a daily basis?
I actually have quite a bit of interaction with nurses as an anesthesiologist. Obviously, the first one that comes to your mind is the nurse anesthetist, who I work with very closely every day, obviously. But also have a lot of interaction with perioperative nurses, both in the preoperative part of surgery as well as postoperatively in the PACU as well.
If you could summarize the image of nursing in one word, what would that one word be?
I think I'd probably say caring. A lot of times nurses are able to give a little more attention to patients individually, and the fact that a lot of times as a physician we end up having several patients at a time, and a lot of times the nurses are able to give a little more one-on-one attention with them and handle a lot of the issues that never even come to a physician's attention necessarily.
Okay, tell us one interaction with a nurse that has made a difference in your life.
There's probably several. The most memorable ones are probably in the intensive care unit, especially during training and things. A lot of times, as a physician in training especially, a lot of times you don't know exactly how things flow in the intensive care unit necessarily, or on any unit, honestly. A lot of times nurses are able to sort of guide you in the right direction. You have particularly sick patients. I can remember several interactions where they were able to give me a little more information and insight as to what's been going on for the months that this patient's been in the hospital that I wasn't aware of, and they certainly had a little better insight into that than I did at the time.
Okay. Any recommendations for future nurses, whether they're working with doctors or just in general?
I think, you know, the future of nursing, I think, needs to probably continue doing what nurses have done for a long time. You know, I summarized a description of nursing as being caring. I think that's at the core of any sort of medical profession, is that you actually worry about patient care and caring for patients and doing what's right for the patient above all else, which is sometimes easy to forget in the day-to-day grind. But as long as you're doing what's best for a patient, then you're doing your job. So.
All right, thank you.
Thank you very much.